was researching this, I came upon an article that was written by the Autoimmune Registry, and they looked at data that was provided by the All of Us Research Program, which is a program that both you and I are virtual advisors for. So the All of Us Research Program is funded by the National Institute of Health. So they collect data from both healthy people and people that may be living with conditions or chronic conditions. And anyways, so the Autoimmune Registry did this research out of the All of Us database, and they found that, get this, 52% of patients diagnosed with autoimmune diseases were diagnosed with a mental health condition within a year. Specifically, 35% were diagnosed with depression, 34% with anxiety, and 24% with both depression and anxiety within the same year. That is huge. And now when you're looking at those statistics, it's pretty scary, but yet it's not shocking to us, right? Because I know with you and looking at so many people now being diagnosed with autoimmune diseases and autoimmune conditions and AiArthritis conditions, with you, Juana, it affected you not just physically, but also emotionally. So can you talk about your personal story, about the impact that your diagnosis with rheumatoid arthritis, which you were diagnosed first with rheumatoid arthritis, and then lupus, how both of those diagnoses impact your mental health?
Well, Estela, I have to say that if it wasn't for the support from my family, especially you, I would not be here today, not only physically, but emotionally as well, because lupus did affect me and rheumatoid arthritis did affect me in many different ways. One of the things that, you start thinking immediately is about the limitations, on your daily life. And managing the treatments. I mean, it's just so many things that, when you're newly diagnosed, you start thinking about, how is this going to affect my children? How is this going to affect me? And so definitely when I was diagnosed, my emotional, mental health was affected. I initially didn't know how to cope with it because all these emotions were just coming to mind. But one of the things that I started doing to help me relieve all the anxiety and stress of a condition that I did not know about was loom knitting. I started loom knitting because I knew that with focusing on something other than what am I going to do tomorrow? How am I going to be tomorrow? How am I going to be how my body's going to react tomorrow is something that helped me. So managing my my emotions by loom knitting helped me. So after my diagnosis, I started loom knitting because I knew that if I didn't focus on something other than the condition and the limitations that I had at the moment was going to really affect me and my family, my young children.
What is loom knitting? For those people that don't know what loom knitting is, can you explain it a little bit?
Yes. Loom knitting is a form of crocheting. So due to the limitations that I was having at the moment, with rheumatoid arthritis, my hands were very stiff. I could barely move them, or I could even, write. So let alone, doing or crocheting. So I found a looming kit. And I just wanted, like I said, I wanted to focus on something else. So I started making scarves. So a loom knitting is you buy a looming kit where you get yarn and you start looping one loop at a time to finally come up with either a beanie or a scarf. So that was something that I started doing. So loom knitting was easier for my hands. It was easier for my mental health because I was focusing on what I was doing. So that's what Loom knitting is.
Yeah, thank you for describing it. Like I know what it is now, right? Because I remember when you first started doing that and then we would be meeting at my mom's house and just like we do every single weekend, right? And we hang out and we were just trying to figure out how were we going to support you, right? Not only by learning about what lupus was, this autoimmune disease, learning about what rheumatoid arthritis was, but we wanted to learn about how we could help you and we didn't know much about it. I know my mom really blamed herself and she didn't know how to help you. She didn't know what to say. I remember, us trying to figure out how we could help you and just knitting, right? My mom would crochet and for a lot of people that don't know this, like we are originally from Mexico. And my sister and I were very young when we came to the United States. And in Mexico, a lot of like the ladies crochet. And, they're always, crocheting. They sit outside, after they clean, they cook, they have dinner, and they're just living their lives, right? Just talking with their neighbors. And yeah, and it's like, that's really what we were doing with my mom and my sister-in-law. And so the loom knitting, even though I'm not good at it, I picked up and I wanted to learn and I wanted to help, I guess, I mean, I don't know what the word is. I wanted to help myself learn so I can help you. And I know we're not all loom knitters, we're not all going to crochet. We're not all going to be doing that. So, but we tried, right? So we started incorporating this in our support groups, and we also realized that not everyone was going to loom knit. Not everyone was going to pick up on crocheting either. So that's when we started.
Especially living in California, right?
Right.
So
Who wants beanies in
or
California?
scarves, but
Right.
it was a form or something that I started doing that helped me, and I mean, we truly feel that not only loom knitting but doing any type of art therapy is going to help with mental health, and that's what I started doing. Not only loom knitting, but I also started painting. So there's different things that somebody that is going through an autoimmune condition not only to reduce the stress, but the anxiety as well, or even depression, just focusing on something other than thinking about your limitations, what you can and what you cannot do, and what can happen to you tomorrow or what can happen to me tomorrow. So definitely art therapy, which is loom knitting is art therapy. And that's something that we, Estela and I, with Looms for Lupus started doing. We started incorporating art therapy, loom knitting being one of them.
Yes. And, one of the things, I love that you shared is, you started doing that even though you couldn't really move your hands, right? And you
Right.
figured out a way to relieve that stress by loom knitting, but also you picked up on creating your own way of using that loom knitting. You created a little technique that would help you be able to fold your hands and use your hands, even though your arthritis was really, it was causing a lot of pain on your joints.
Absolutely. I mean, and that's, that's something that we always have to do. We always have to find ways to continue because we cannot focus on what we cannot do. We have to find ways. And that's something that also will actually, I mean, how can I explain it? One of the things that affects us with our emotions is not being able to do things, but we always have to find ways on still doing what we want to do. So yes, I definitely found a way on how to loom knit, though it wasn't easy at the beginning, but with techniques and looking for ways to do it, I was able to loom knit a couple of beanies. I loom knitted a couple of scarves. I gifted a couple of shawls from loom knitting.
Yeah. And, it's amazing because, again, it's not all about Loom knitting. What we're talking about is just finding different strategies and coping mechanisms to deal with when you're living with an autoimmune disease or an AI arthritis condition. And, when we're talking about this, we're not talking just about to the individual about coping mechanisms. We're talking about also coping mechanisms for the caregiver and the families and the loved ones. When we're looking at the impact of autoimmune diseases and or arthritis conditions in the United States, there are about 5% to 8% of the US population that are diagnosed with autoimmune diseases. That's a lot. That's pretty high. And so when we're looking at the big picture, it's like, let's talk about the impact of autoimmune diseases and arthritis diseases and the impact that it has on our mental health, right? And let's talk also, and you just shared a little bit about a couple of coping mechanisms that you use, but the next thing that I want to talk about is just different strategies that we can utilize when we're coping with autoimmune and or arthritis conditions, right?
Estela, before we go into that, I really want to also focus on, this autoimmune conditions or arthritis conditions is not only affecting the patient, it's also affecting the caregivers and loved ones. So it's very important for also to help our caregivers and our loved ones incorporate all these techniques because the patient is not the only one that's affected. So we want to make sure that, all these techniques are also practiced not only by the patients, but also by the caregivers, loved ones. And, mental health or mental health is not only affected because we're going through these changes in our bodies, but our caregivers looking at us and not knowing what's going to happen with their loved one is also hard for them. So definitely a caregiver is affected.
Yeah. And I think that's it's the unpredictable, right? It's these flares that these autoimmune diseases or arthritis conditions cause, and not knowing, how bad they're going to be, not knowing when they're going to come, not knowing how it's going to impact our daily lives, how it's going to impact our loved ones, how it's going to impact our physical lives as well, how it's going to impact our love life, our marriage life, our life just in general. And I think that is the stressful part of it, is the unknown, right? The unknown of the impact of the flares, the unknown of the impact of this disease. So I'm with you. One of the reasons why when I first started the podcast, I talked about me being an advocate for healthcare, for care partners and loved ones. I put that first because that was really my role. And also understanding that our role does change throughout the process. When we first started advocating together, we advocated as the sisters. You were living with the autoimmune diseases and rheumatoid arthritis and arthritis conditions. And I was there as a supporter. I was there as a loved one, as a caregiver. And now, as of last year, I now was also diagnosed with rheumatoid arthritis, and that has shifted a lot of things. And, for those of you that don't know this, it is so difficult to know that you could be the best advocate for someone else, but when it comes to you and you realizing and accepting your condition, it is a whole other ball game. And I have been struggling with it. I have been struggling with it since December when I was diagnosed with rheumatoid arthritis. Not many people know that I do live with rheumatoid arthritis. And that is why I wanted to talk about this because, we transition into different roles in our lives. We are healthy individuals. We are loved ones and care partners to someone that lives with an autoimmune or arthritis condition. And then we may also be the patient as well, and give ourselves the opportunity to accept those different roles, give ourselves the opportunity to learn about the conditions, and give ourselves the opportunity to go through those grieving stages on when you are diagnosed. So we always say this, it's important for you to learn about your condition. It is important for you to learn about how to take care of your bodies and yourselves, and then learn about how to communicate with your care providers, with your care partners, and with anyone around you, right, that you're dealing with. But most importantly, practice self-care. Practice to learn about how to take care of yourself.